In these times of the COVID-19 pandemic, have you ever asked yourself, is it safe to come into the dental office? Perhaps a better question to ask might be, do dental offices spread the coronavirus between patients? Both the Center for Disease Control and the American Dental Association have asked these questions as well. To date, there is no data which suggests that this is the case, but how is that possible? I'd like to take a moment to reflect back to June of 1981, the beginning of the AIDS epidemic. Things were very different then. Before that time, the wearing of masks, even the wearing of gloves, if you can imagine, was unheard of. For those of you old enough to remember, dental instruments were not sterilized, but they were rather disinfected by placing them in a blue solution. In response to that potential epidemic, the dental profession rose to the challenge by adopting a new infection control policy. Ultrasonic cleaners, autoclave sterilizers, surface disinfection agents, as well as masks and gloves, became the new accepted standard of care. And in fact, our office was one of the first to adopt an institutional cassette system to ensure sterility of equipment from patient to patient. Back now to the present. In mid-March to the end of May of this year, for 2 full months, our office was shut down in order to rethink and put into place enhanced infection control procedures. At the Friedler Dental Group, we are committed to the safety of our patients, our staff, and our doctors. We have multiple layers of safety measures in place for you, and we're constantly reevaluating and training staff to incorporate procedural techniques with the best technologies to deliver them. Before I get into the new equipment we have installed for your safety, perhaps the biggest concern in a dental setting is to control who comes into the office and the pace of flow of the patients through the office. Utilizing this screening protocol, we routinely reappoint 3 to 5 patients per week, and we require a negative COVID test after 14 days before they can even think of returning for an appointment. The next challenge is to capture and kill any and all microbes generated during dental procedures. Here is where new technologies and equipment have been installed to ensure your safety. First off, there are things you don't see because these are structural additions that have been installed in the office's ventilation system. And those are hospital-grade operating room air scrubbers. Active air purification technology units are located within the ducts of our dental office HVAC systems. These systems produce ionized hydroperoxide and negative zinc ions, which instantly kill viruses and bacteria on contact, both in the air as well as surfaces exposed to the air, thus purifying every cubic inch of air that the HVAC system reaches in both the dental treatment rooms as well as the common areas. Next, we installed Honeywell 50250 HEPA air purifiers in every operatory, which removes airborne particles and recycles the entire room volume every few minutes. And lastly, for added safeguard, we use the suction tool placed close to the patient's mouth to vacuum any droplets from air not captured by our normal high-volume suction techniques performed during a dental procedure. The captured air is then purified with additional HEPA filters and ultraviolet Type C sterilizing lights. For heightened diligence in surface disinfection, in order to ensure clean and sterile environment, dictates an increase in time between patients. You will see the staff and doctors wear all manner of personal protective equipment, otherwise known as PPE, from head to toe, including N95 masks, gloves, gowns, hair coverings, and shields. This ensures the safety of our staff, which in turn protects you, the patient. So you see, our new normal is quite extensive and has been put into place with one goal in mind: to keep your visits with us safe. We have an amazing team of professionals ready to help you with your professional questions and concerns. Call us anytime at 203-245-7575 during normal business hours, and you can get a hold of me directly in case of dental emergencies after hours at 203-605-2232. I'm Dr. Friedler, and I'd like to thank you for taking the time to view this most important message. My entire staff and I look forward to seeing you in our office soon. Thank you.